Assalamu alaikum and welcome to the new lecture on diarrhea. The material for this lecture has been taken and adapted from Lippincott's Illustrated Reviews Pharmacology, Basic and Clinical Pharmacology 11th edition by Bertrand G. Kedzen, and Clinical Pharmacy and Therapeutics by Roger Walker. I am Sheikh Mohammed, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. So this is the outline of the lecture. Firstly, we will be having the introduction on diarrhea, then its pathophysiology, signs and symptoms, diagnostic test, and finally we will be discussing the treatment for the diarrhea. So diarrhea is basically the reversal of normal net absorptive status of water and electrolyte absorption to secretion. That means the specific amount of the water that has to be absorbed into the systemic circulation is not absorbing into the systemic circulation, and the amounts of the electrolytes that have to be secreted into the gastric lumen are not being secreted. So there is an imbalance between the water and electrolytes into the gastrointestinal tract. We can further classify the diarrhea into the acute diarrhea and the chronic diarrhea. Now, the acute diarrhea can occur abruptly, and the patient may be having 3 or more loose stools per day, and this may be go for about no longer than 14 days. The acute diarrhea is most often caused by the viruses, bacteria, protozoa, and generally it is self-limiting. But however, we have to give the treatment to the patient to return to the normal physiology, because with the continuous loss of the water and the ions, the patient may go into the hypovolemia and there may be electrolyte imbalance into the body, while the chronic diarrhea may last for more than 14 days. Now, as earlier discussed, the diarrhea is an imbalance between the absorption and secretion of the water and electrolytes. The proper amount of the water is not absorbing, and the proper amount of the electrolytes are not being secreted. So this causes an imbalance into the body, and this changes into the absorption and secretion of the water and electrolytes may occur into the GI tract, maybe due to some inter problems inside the GI tract and some problems outside the GI tract, like any of the toxic substances or irritants that are present into the GI lumen. So they will be causing the irritation of the gastric mucosa and the intestinal mucosa, and eventually gastric motility will be increasing, and there will be imbalance in between the reabsorption of the water and secretion of the electrolytes. There are certain drugs which might even increase the gastric motility, and eventually with the increased gastric motility, more watery stools will be coming, and there will be less reabsorption of the water. And if we further classify the mechanisms by which the diarrhea can occur, and based on these mechanisms we will also be giving the treatment to the patients. So there are basically 4 mechanisms by which the diarrhea can occur. So number first mechanism is the change into the active transport of the sodium. The sodium is being less absorbed, and there is increased secretion of the chloride. So there is an imbalance between the sodium absorption and the chloride excretion, and eventually ions will be present inside the gastric lumen, and these will be causing the irritation to the gastric lumen, and watery stools will be coming. The second main causes may be the change into the intestinal motility. So these may be caused by some drugs. This may be caused by some toxic substances that are present into the gastrointestinal tract. This may be even caused by the microbial flora. The third reason is the increased luminal osmolarity. So there are certain other substances which, when present inside the gastric lumen, or the we say the intestine, they cause more of the absorption of water, and more water is coming to the intestinal lumen, and that water will be moved out into the stools, and there will be more loss of the waters. And third reason is the increased tissue hydrostatic pressure. There may be constriction of the intestine, and eventually there will be less gastric motility, and more watery stool will be appearing. So based on these mechanisms, the diarrhea can be further classified into secretory diarrhea, osmotic diarrhea, inflammatory diarrhea, and diarrhea due to increased intestinal motility. Now, in the secretory diarrhea, there are certain stimulating substances like the vasoactive intestinal peptides, there may be the laxatives, or certain bacterial toxins. Now, these substances are increasing the secretions, are decreasing the absorption of water and electrolytes, and the patient will be suffering from the secretory diarrhea. Now into the osmotic diarrhea, there are certain poorly absorbed substances which are present into the intestinal fluids, and when these substances are present into the intestinal fluid, they are taking up more and more water. Like if there are excessive amounts of the sugar and salt, so because of the different into the osmolarity, the salt and sugar will be taking the water from the surrounding, and it will also be taking the water from the intestine, and more water will be accumulating into the intestinal lumen, and this will eventually lead to the watery diarrhea. Okay, and this will result into the body to bowel. The next type is the inflammatory diarrhea. Now, if the patient is suffering from any GIT problem in which there is inflammation into the intestine, like in inflammatory bowel disease, there may be certain parts of the intestine which may be inflamed. Even in certain infection, there may be certain parts of the intestine which will be inflamed, or if the person has taken any toxic substances or poisonous substances, this will also be damaging the intestine, causing the inflammation or bleeding into the intestine, and this will lead into the inflammatory diarrhea, and we call it as the inflammatory diarrhea. Now, in this situation, of course, there is inflammation due to an infection. There may be damage to the intestine, and there will be blood present into the intestine. So the mucus will also be appearing into the stool. There may be proteins present into the stool, as well as the blood will also be present into the stools. The last type is the diarrhea due to the increased intestinal motility. So when there is any of the substance the patient has intaken which is increasing the gastrointestinal motility, or if there is any premature emptying of the colon, maybe because of the presence of any bacteria or any irritant, and that is causing the increased intestinal motility, so this will lead into the diarrhea as well. Now here is the list of the signs and symptoms which will appear on the patient, and will depend upon the severity of the infection or the changes into the physiology. And these signs and symptoms may include the nausea, vomiting, abdominal pain, headache, fever, chills, malaise, painful stooling, cramping, weight loss, chronic weakness, and anorexia as well. Now into the diagnostic test, we might have to go for the analysis of the stool for the microorganisms to make sure that whether the diarrhea is because of the any infection, and if any of the microorganisms have been found, the treatment is carried out accordingly and the antibiotics are prescribed accordingly. We have to also go for the determination of blood present into the stool, or mucus present into the stool, or fat, or changes into the pH or electrolytes, and the mineral concentration as well, because as earlier discussed, in certain type of the situations or the pathologies, the diarrhea will be due to the any inflammatory condition, or any bleeding into the intestine will also be present. So we have to make sure that whether any blood or mucus is present or the fat is present, which will assure us that the intestine and is inflamed, and the treatment should be carried out accordingly. For the diagnosis, we also have the stool test kits which can diagnose the GI viruses like the rotaviruses, and that can easily help into the determination that whether the infection is caused by the any of the microorganisms. In certain other situations, if the, for example, the diarrhea is not being treated with the conventional medicines or the conventional methods, so the endoscopy or the biopsy may also be ordered to make sure the what is the cause of the diarrhea, because as earlier discussed, the diarrhea may be because of the inflammatory bowel disease that includes the Crohn's disease as well, in which there is inflammation. There are certain cancerous situations in which the patient will be having the symptoms of diarrhea. So to make sure that the patient is not suffering from any colitis or any type of the cancer, so we have to go for the endoscopy or biopsy of the intestine as well. In certain other situations, we can also go for the radiographic studies to make sure that whether there is any neoplastic or inflammatory condition present into the intestine. For the treatment of diarrhea, the pharmacological as well as the non-pharmacological treatments are both very important. Into the non-pharmacological treatment, we have to ask the patient to stop taking the solid foods for about 24 hours, and also stop taking the dairy products, because more and more food and the dairy products will be causing more intestinal motility and more diarrhea. So the patient has to stop taking food for about 24 hours. And if vomiting is also present, as we discussed, that vomiting is also one of the symptoms of the diarrhea. So if the vomiting also present, so none are, and even it is not controlled by the administration of the anti-emetic drugs, so nothing should be given through the oral route. Even the drugs should not be given through the oral route, because of the vomiting, they will not be useful. And after stopping the food and giving the some administration of some drugs, and there is certain recovery of the bowel movement, then the blended diet should be given. The solid foods still should not be given. uh, the rehydration is of utmost importance into the treatment of diarrhea. We have to maintain the level of the water and electrolytes throughout the treatment. So the first of the class of the drugs that are used for the treatment of the diarrhea are the anti-motility agents. These are also known as the opioid agonist, and these are analogs of the mepridine and have opioid-like actions on the gut. Now, these drugs act on the presynaptic receptors, or the opioid receptors, that are present into the enteric nervous system or the GI nervous system. And when these drugs are binding with these presynaptic receptors, they are stopping the release of the acetylcholine, and eventually when there is no release of the acetylcholine from the presynaptic neuron, it will not be acting onto the postsynaptic neuron, and eventually the gastric motility or the paracelsus will decrease. Two major drugs of this class are the loperamide and the diphenhydroxylate. The loperamide is a non-prescription opioid, while the diphenhydroxylate is a prescription opioid. So this is the list of the anti-motility agents that are available into the market. Number one is the loperamide, that is available into the market with the name of Imodium in the capsule form, 2 mg. It's given as 4 mg initial dose, and then 2 mg after each dose stool, and its maximum dose is 16 milligram per day. The next agent is the diphenhydroxylate along with the atropine. The marketed formulation is a tablet form Lomotil in 2.5 mg and 25 microgram of the active ingredients. This is given as 5 mg 4 times a day, and the maximum dose is 20 mg per day. The next agent is the morphine, that is available into the market as capsule Magnus. in modified release form into the 10 mg strength and 30 mg strength. It is given 2 to 4 mg to 1 to 4 times a day. And last is the diphenoxin along with the atropine. The diphenoxin is the derivative of the diphenoxylate, and it is 5 times more potent than the diphenoxylate. It is also given along with the atropine, and the marketed formulation is the morphine in the strength of 1 mg of diphenoxin and 25 microgram of the atropine. It is given as initially 2 milligram orally, and then 1 milligram after every stool, and the maximum dose is 8 milligram per day. The next class in the antidiarrheals are the adsorbents. Now these agents basically adsorb any of the intestinal toxins that are present into the intestinal tract and causing the diarrhea, or any of the microorganisms as well. And even they can provide the coating or protecting layer onto the intestinal mucosa, thereby saving the intestinal mucosa by the toxic effects of the toxins and the microorganisms. However, they are less effective than the antimotility agents, and as they are the adsorbents, they can interfere with the absorption of the other drugs as well. So here are some commonly used adsorbents that are used in the treatment of the diarrhea. Number one is the combination of choline and pectin that is available into the market in suspension forms with the name of Coplex. It is available with the strength of 5.8 gram of choline and 0.13 gram of pectin per 30 ml of the suspension. It is given as 30 to 120 ml after every loose stool. The next agent is the etopergine that is available into the market in tablet form with the name of Intox-P as 500 mg tablets. It is given as 1200 to 1500 milligram after every loose stool, and the maximum dose is 9000 milligram or 9 gram per day. Next class is the fluid and electrolyte transport modifiers. The commonly used drug is the bismuth subsalicylate that is available into the market in tablet form with the name of Bismol 265 milligram. It is given as 2 tablets every 30 minutes or 2 tablets every 1 hour as needed, and the maximum dose is 8 doses per day. Now its mechanism basically involves the coating of the intestinal lumen, and salicylate component is also involved into its action. It basically also decreases the fluid secretion into the bowel, and eventually there will be stoppage of the watery diarrhea. It is basically a non-prescription drug and also used for the treatment of the traveler's diarrhea, and its adverse effect include the black tongue and black stools. Next class is the bile salt binding resins. Now, if there is increased amount of the bile salts into the intestine, they can also cause the diarrhea. And these excessive amounts of the bile salts may be due to any disease of the terminal ileum. There is inflammation of the ileum, for example, Crohn's disease may cause problems into the terminal ileum, or there is any surgical resection into the intestines. So this will cause the malabsorption or decreased absorption of the bile salts, because when the bile salts are coming into the intestine, they are help into the absorption of the fats, and the bile salts are reabsorbed. But if they are not reabsorbed because of the certain problems like the surgical resection or the disease of the terminal ileum, they will be present into the intestine and they will be causing the diarrhea. So basically, the cholestyramine and cholestyramine that are used into the treatment of the hypercholesterolemia, They are used here to control the diarrhea. Basically, they will be making complexes with the bile salt binding resins and helping into the excretion of them, and thereby they will decrease the treat the diarrhea caused by the bile acids. The adverse effects caused by these drugs include the bloating, flatulence, constipation, and fecal infection. Next agent is the octreotide, that is basically the synthetic octapeptide, and it has similar action to the somatostatin. The somatostatin is growth hormone, inhibitory hormone, and it also has actions onto the gastrointestinal tract, that it is decreasing the gastric motility as well. The octreotide basically reduces the intestinal fluid secretion. Now, if less the fluid is secreted from the intestine into the intestinal lumen, so less chances of the diarrhea will be there. And the octreotide also decreases the pancreatic secretion. So pancreas secretes the bile acids or makes the bile acids, and eventually if more of the bile acids are present into the intestinal tract, there are more chances of the diarrhea. So both of the situation, the decreased intestinal fluid secretion and the decreased pancreatic secretions will treat the diarrhea as well. This agent also slows the gastrointestinal motility. So less the motility, less will be the diarrhea, and it also inhibits the gallbladder contraction. So if there is more contraction of the gallbladder, there will be more bile acids coming into the intestine, and if the gallbladder contraction is inhibited, less bile acids will be going and less chances will be of diarrhea. It is also used to treat the secretory diarrhea due to the gastrointestinal neuroendocrine tumors. There are certain other tumors that are present into the gastrointestinal tract, and these tumors are causing the increased gastric motility, and eventually the patients will be having diarrhea. So the octreotide can also be used in those situations. The octreotide can also be used in the treatment of the diarrhea due to the vagotomy. The vagotomy is basically the removal of the certain branches of the vagus nerve. That is basically done due to the decrease to decrease the gastric acid secretions. But if certain branches of the vagus nerve are removed, they will cause the increased gastric motility, because activation of the vagus nerve will cause decreased gastric acid sorry, the intestinal motility, and inhibition of the vagus nerve will cause the increased motility. So if there is no vagus nerve, there will be inhibition of the vagus stimuli, and there will be increased motility that will be causing the diarrhea into the patient. So octreotide can also be used to treat the diarrhea due to the vagotomy. The octreotide can also be used to treat the diarrhea due to the dumping syndrome. In dumping syndrome, there is an problem with the stomach, and the stomach is emptying very quickly. Now, if the stomach is emptying very quickly, the gastric contents will be moving very fast through the small intestine and the large intestine, and there will be malabsorption, and the patient will be having diarrhea. So, octreotide can also be used to treat such situations. It can also be used to treat the short bowel syndrome. In short bowel syndrome, the patients are having smaller small intestine. Okay, the length of the small intestine is not so large. Now if the length of small intestine is not so large, there will be malabsorption into the small intestine, and the food will be rapidly going into the large intestine, and the patient will be having diarrhea, because not much of the content from the food or the from the content that are coming from the stomach have been absorbed, and eventually patient will be having the diarrhea. So octreotide can also be used in such of the situations, and octreotide can also be used into the diarrhea that takes place in the AIDS. Now, in the AIDS, we know that the immune system is deactivated, the immune system is weakened, it is not working properly. So, there are more chances of the infections, and the AIDS patient will also be having frequent diarrhea due to the infectious microorganisms. So, octreotide can also be used in diarrhea in the AIDS. Now the doses of the diarrhea, the octreotides available into the injection form with the name of the sendostatin with the strength of 50 microgram per ml. Its dose is initially 50 micrograms subcutaneously 1 to 2 times a day. Then we have to titrate the dose. That means we have to increase the dose depending upon the indication and then continue the dose. Its maximum dose is 600 microgram per day in 2 to 4 divided doses. In the last, we have the probiotics for the treatment of the diarrhea. As we know that the some of the microorganisms or bacteria are very useful for the absorption process into our GI tract, and their absence make us diarrhea and problems of the malabsorption. So in certain other situations, we deliberately administer these bacteria to the patient to treat these malabsorptive situations and to treat the diarrhea. The commonly available formulations can contain the Lactobacillus acidophilus bacteria and Lactobacillus bulgaricus bacteria, and they are given as one granule pegged 3 to 4 times a day along with the milk, juice, or water. So this was all about diarrhea. Thank you very much for your time.